I'm going to review the chart for any allergies and the code status of the patient. Gathered my supplies, so I'm going to go ahead and enter the room. Hey, I'm Erin. I'm your student nurse today, and I'm going to be providing a physical assessment for you. Could you tell me your name and date of birth, please?
Yeah, my name is Kaylin Tebow. My birthday is 10/24/1994.
Okay. So, I've checked all your vital signs. I've checked your chart, and everything looks normal. So I'm going to go ahead and just ask you a few questions before we get started.
Okay.
So, do you have any allergies?
Yes, I am allergic to Dove products and tramadol and trazodone.
Okay, great. So, do you know your height and weight?
Yes, I'm 5'3" and 115 pounds.
Okay, so are you in any pain today at all?
Nope.
All right. So, can you tell me where you are, what time it is?
Yeah, I am in the hospital and it is about 1 p.m.
Okay, you're right. So, your hygiene looks fine. You take good care of yourself. So now I'm just going to go ahead and inspect your skull.
Okay.
I'm just checking for any thinning in your hair, any asymmetry on your scalp, and your hair also looks healthy. So everything's fine. Now I'm going to inspect your face. So if you could look at me and raise your eyebrows. All right, and smile with teeth and frown. Okay, so I'm going to go ahead and take a closer look at your eyes. I'm just looking at the color, I'm looking at your eyebrows and your eyelashes. So now I'm going to shine a light into your eyes, and I'm just checking your pupils. Okay, so I'm going to put this closer to your nose, just follow it. All right, your pupils are equal and reactive. So now I'm going to go ahead and check your nose. If you could just tilt your head back for me. I'm just looking up to see any drainage or swelling. Everything looks fine. So I'm going to move on to your ears. I'm sorry, before we move on to your ears, can you press one nostril and close your mouth and breathe out? Switch. All right, so now I'm going to check your ears. Kind of doing the same thing with your ears, checking for drainage and swelling. Okay, so everything looks good with your ears. Now I'm going to be looking at your mouth. I'm checking your tongue, your gums, and your throat. I'm looking for color and for any lesions or any dryness. Stick your tongue out for me. Okay, great. Everything looks fine there. Now I'm going to be assessing your breathing. So just breathe normally. I'm just looking for your rate, your pattern, and if everything is symmetrical. All right, everything looks healthy and normal. Now I'm going to listen to your heart before I listen to your lungs. And the last spot that I just listened to, I'm going to listen to for a full minute again.
Okay.
All right, it's been 1 full minute. So now I'm going to be checking your breathing. You can breathe normal this whole time. I'm going to listen to 6 places on your front, 8 in the back, and 2 on the sides. Now your sides. Okay, everything sounds good there. So now I'm going to be looking at your upper chest. I'm going to be feeling your upper chest and your upper back just to feel for any masses or abnormalities. Okay, so now I'm going to be checking all your pulses. I'm going to start with your neck. So if you could look one way and I'll feel in the other side. So I'm going to be checking your radial pulses on your wrist at the same time. Okay, awesome. If you can put your feet on the ground, I'm going to check your pedal pulses at the same time as well. Okay, so I'm going to check your tibial pulse, which is right around your ankle. Your popliteal, which is right behind your knee. And next I'm going to check your femoral. And the last, I'm going to check your brachial, which is right around your elbow. Great. Can I look at your hands? Just looking for temperature, the color. I'm going to press on your nails a little bit. Check the color. And then one more thing, I'm going to pinch it on both sides. Right? Everything looks good with your hands and your skin. So now I'm going to be checking your abdomen. So if I could have you lay back really quick. Just lift your shirt up just a little bit. I'm looking for any scars or lesions. Everything looks good, so I'm going to go ahead and listen. All right, you can put your shirt back down. Now I'm going to go ahead and feel your stomach. Tell me if you have any pain or tenderness.
No pain.
All right, now I'm going to palpate your bladder a little bit. All right, thank you. So for the purposes of this video, I'm going to verbalize that I did pericare, checking for any discharge, lesions, or pain. Next, I'm going to check for her skin. So just go ahead and stick your arms out, flip them back over. All right, everything looks good there. Your color is good, no scars or wounds. You can go ahead and put those down. So I'm going to check your nail beds and your toes just like I did for your fingers. All right, you're good. So next I'm going to check your joints. I'm going to look for any warmth or redness. Make sure that they're not swollen. Right, everything looks good. So I'm going to put my hand against your face and have you push against it on each side. Okay, and now I'm going to put my hands under your feet and have you push. Now I'm going to put them on top and have you push against again. Okay, And now I'm going to have you shrug against my, you can stand up. I'm going to go ahead and have you shrug. Shrug. And so everything looks balanced and strong. Now I'm going to check your range of motion.
Okay.
So if you could stick your arms out like this, touch your shoulders, and now put your palms up and touch each finger to your thumb and go back. Take your hands like this and go down and back up. So now I'm going to check your spine. So if you could touch your toes really quick. Okay, everything looks good. Go back up. Now we're going to put our hands on our side and go back and forth and the other way. Awesome. And then put your hands to your side and lift each leg. Awesome. So you can go ahead and have a seat. Oh, I'm sorry. Could you stand up again and do heel to toe, 4 steps each way? Awesome. You can go ahead and have a seat. So that was the end of the assessment. Everything looks great. I'm gonna go ahead and document everything that I found and give it to your provider. Can I do anything to make you comfortable?
No, thank you.
All right. Have a good day.
You too.